ஹாய், இன்னைக்கு நம்ம பயோகெமிஸ்ட்ரி பிட்ஸில் நம்மளோட கேஸ் பேஸ் பயோகெமிஸ்ட்ரி டிஸ்கஷன்ஸ் எபிசோட் 7 போகலாம் வாங்க. என்ன கேஸ் ஃபைல் இருக்குன்னு பார்க்கலாமா? கிளினிக்கல் ப்ரெசன்டேஷன் இந்த மாதிரி இருக்கு. ஒரு 60-year-old மேல், ஓகே, ஒரு 60-year-old மேல் மேன் வித் a long history of smoking, presence with difficulty in breathing, fatigue and significant drowsiness. ஸோ இது எல்லாமே கிளியராக இருக்கு. ஸோ history of smoking, a 60-year-old male. Physical examination. On examination, you're finding that on auscultation, you will see slow and shallow respiratory rate. It is low, confusion, and mild bluish discoloration of the lips. That is called cyanosis. So these are the physical examination findings. The next step will be we will order lab investigations. So lab investigations, arterial blood gas analysis was ordered and these were the findings. These are the typical findings which a first year MBBS should know. So pH, this is a reference range which is mandatory for you to know, and this is the patient's value which is 7.28. So it is lower than the reference range, which means the patient is in acidosis. PaCO2 is 55 mm mercury. The normal value is given here, so it is slightly elevated, and bicarbonate is normal. So this indicates the primary change is in PCO2, which is an increase in PCO2, and PO2 is also less because the patient is having difficulty of breathing. So with these findings and the clinical scenario and the examination findings, our diagnosis points towards a clinical study of respiratory acidosis. Why is it respiratory acidosis? The patient is unable to breathe effectively. As you can see, he's having difficulty in breathing. So what happens? And he's also a chronic smoker. So what happens? He will not be able to push out the excess carbon dioxide from the body. Adanal reduced carbon dioxide removal from the body. So now let us see the biochemical basis behind this particular respiratory acidosis, the simple mechanism. So first of all, hypoventilation. The patient is having difficulty in breathing. So what happens? What is the process of breathing? You take in oxygen and you send out carbon dioxide. But here you are not able to send out the carbon dioxide. So carbon dioxide accumulates inside the body and it goes into the blood, accumulates inside the blood. What happens? It cannot stay as such as carbon dioxide. It will combine with water in the body and form carbonic acid. This reaction you will know, CO2 plus H2O gives H2CO3. So that is carbonic acid, and any acid cannot be present as acid inside the body at our normal plasma pH. So it will be present in the ionized form. What is the ionized form of carbonic acid? H plus and bicarbonate. So this leads to an increase in H plus ions. This increase in H plus ions makes the blood more acidic, and that is why your pH is lowered. So just understand this simple pathophysiological chain. Hypoventilation will lead to carbon dioxide retention. That is, carbon dioxide is accumulated inside the body. As a result, carbonic acid, that will increase the H plus and that will lead to decreased pH. Understand this basic mechanism at first year level. So now for at an extra level of point which is required for a first MBBS will be what are the causes of respiratory acidosis. So you can have a mnemonic here which is brain lag. Okay, so you have to understand there is a respiratory center in the pons or medulla which is in the brain. So anything which is going to depress your respiratory center will also cause difficulty in breathing and hypoventilation. So the first B stands for brain depression, which is caused by opioid overdose. The BR, okay. Then A stands for airway obstruction, as it occurs with the help of as it occurs with a foreign body or bronchospasm kind of. Then I stands for injury, neuromuscular injury, like conditions like Guillain-Barré syndrome or myasthenia gravis, where your respiratory muscles will become weak. And then you have N for nerve or spinal problems such as spinal cord injury. Then LAG stands for L is for lung restriction. Any lung disease which causes the restriction of the lung movements like pulmonary fibrosis or severe obesity. And A for abnormal chest wall abnormalities like kyphoscoliosis, that can also restrict your lung movements. Then you have G gas exchange failure, as it occurs in pneumonia or any infections of the respiratory system. So these are the common causes which you need to remember. In short, respiratory acidosis is a decrease in pH and the primary change will be an increase in PCO2. That is, your body is hypoventilating, you are not breathing well, so carbon dioxide accumulates inside the body. What kind of things will not allow you to breathe well? Any depression in the central nervous system at the respiratory center. So any central nervous system depression will also cause respiratory acidosis, and any restrictive lung diseases which restricts the movement of oxygen and carbon dioxide into and outside of the lungs will also cause respiratory acidosis. Just remember this basic factor. In addition, you need to know how you will expect, how much compensation you will expect, because now the PCO2 is high, you will expect a bicarbonate increase to compensate for this. So how much is calculated by these two sentences. In case of acute respiratory acidosis, acute, the condition, the cause for the respiratory acidosis should be an acute condition. In such cases, bicarbonate increases by 1 milliequivalent for every 10 mm rise of PaCO2. And same in case of chronic respiratory acidosis, bicarbonate rises by 3.5 milliequivalents for every 10 mm rise in PCO2. So this is the formula for calculating the compensation. Hope this would have given you an overview of respiratory acidosis at a basic level.